Good morning to everyone. Welcome to PharmaCast, organized by Pharma Vision, powered by Vilas College of Pharmacy. Today we have our guest, Mruthyunjaya sir, head of the Department of Orthopaedics, FAME Hospital. We welcome you, sir. We are very glad to have you in this session today. We have few questions for you, sir. Let's head with the questions. So, what are the challenges you have faced as an orthopedician for all these years, sir?
So there has been a lot of difference between orthopedics or any doctor for that matter and the person who comes for consultation. So earlier thing what used to happen was, so they had a total belief on the person whom they are consulting. So there was a total belief from the aspect of the parent, from the person who is suffering, and the doctor. So they believe doctor as a complete healer. Once he goes to him, so it will be totally relieved. So my boy will be totally relieved, and he will be really a person of whom we can trust him. So the trustworthiness was there from both the sides, and from the doctor side also. So he was trusting them. Look, whatever I say, whatever I tell, they are going to follow it, and they are going to be cured. So this trust was there between the two professions, the person who needs and person who is treating. Now what has happened? The problem has arisen from both the sides. So the parents always feels that the doctor is overcharging him, so he is doing unnecessary investigations. So unnecessarily he is emptying his pocket. So that is what the parent says. And the young fellow who is coming for the healing, what he feels, he would have read something, headache or something, some googling he would have done, and he will feel, so will this fellow going to treat me something? So he is also doubtful, and the person is also doubtful. And what about the doctor who is treating? Then he will see him now as a person who is trying to find out what he is, what I am now. So he doesn't trust. He is not trusting me, and I should not go for court. Now the medical profession has become the customer or consumer forum. So we also have to play safe. So I would like to do all investigations so that I don't miss anything, because he may sue me any time. You have not done this, or you have missed this, and because you have not treated me properly or diagnosed me properly, I will land in this trouble. So he is also worried that his treatment may go wrong somewhere, which may happen anywhere, any profession for that matter. So when we keep describing every aspect of the healing process, so patients may not come at all because they will be too much worried. So this usually happens when we are studying our medical books. So when we study, when we are reading about some disease, we feel this disease is, I am suffering. So another disease, when I go, oh, this is also I am suffering. So this happens many times because it is so confusing. The human body is created in a very complex methodology. It is very difficult to understand 100%. It is impossible. So whatever we have understood, we try to solve, or we try to give it to the society and heal them. So these kind of unbelieving. So everybody is on a question mark. What will you do? What will you do? So that becomes a remark. So when we don't believe somebody, whether it is a husband and wife, whether it is a parent or a child, it is a belief which is going to bond both of them together. So that is where I am feeling this bondage is not there because that belief is not.
Yes, sir.
So that is a main challenge for any professional, especially orthopedic or the medical profession, which is trying to do something good for the society.
Yes, sir.
Yeah,
So we know that Vilas College of Pharmacy have been tied up with FAME Hospital for research purposes and also for internship for sixth year pharmacy students. So what are the opportunities given to students in that hospital, and what students are exactly doing in the hospital right now?
So right now they are posted there. So when I come there, so they are doing some, because as a Form D project, they have got to project some project work. Project work is something that the methodology of research. So how they should go about the research, what they should do, how they collect the data, and how they analyze the data, and then put forth their own result. So that is a process of research. So this kind of training has been given, data collection has been done, and there are Like orthopedic surgeons, they are also professors who are going to guide them how to collect the data, how to analyze the data, how to do a statistical analysis, and how to present it as a paper to the different areas. So we have pharmacy there. So they will be posted in pharmacy, they will be posted in the wards, they are posted in the outpatient departments, and they will interview the patients. They go through all the pharmaceutical indices, whatever that has been kept in the pharmacy department, and then they talk or communicate with the doctors there. And if there is any problem in the prescription, so whether they have over prescribed or there is some drug allergy which doctors might have not elicited from the patient side, so because they have a little more time, so they can communicate with the patient directly and then inform the doctor she is allergic to this and you have prescribed it, so can you review it. So that way they can help in the doctor's profession for orientation. Or sometimes we prescribed, all the patients will not act in the same way. That depends on the human body. So some people might develop allergic reactions or some complications. So since you are there posted in the ward, so they may be able to identify them much faster than the nursing staff and then inform. So the drug informatory is also a very important aspect in the Pharma D training project. So that also they will be able to do it. So I think this will be a very main project, or the usefulness of the communication between Pharma D students and the orthopedic surgeons in the hospitals.
So, what's the piece of advice you would like to give for the family students, sir?
The Pharma D students, it is also like a paramedical kind of a thing, which are supportive to the healers. So everybody is a healer. So maybe the main project. So everyone cannot become the head. So maybe head could be a doctor who is treating. So a nursing staff, a pharmacist staff, or even the Aya who is cleaning the whole hospital, or the nursing staff who is making the bed or the OT table. So everyone is projecting towards the patient's welfare. So if you all can understand each other and go in a cohesive manner, so then the results will always be better and good for the patient care.
Yes, sir. Thank you so much, sir. We are very glad to have you today, sir.
So,
Thank you.
so thank you.